Hi, my name is Kenny Garcia, and I would like to welcome you back to the Kenny Garcia Show. Here we have Ty Hellowa, who we tested for bladder cancer. The test came back positive.
Oh, hell no!
We are going to take a short break from the Kenny Garcia Late Night Show to bring you this Doctor's Corner, which is going to be information more in depth about bladder cancer.
About 77,690 people were diagnosed with bladder cancer in 2014, and about 15,580 people died from it. It is the sixth in number of cases of all cancers.
Scientists from many universities are discovering more effective urine tests and are understanding genetic changes in bladder cancer more.
Possible causes of bladder cancer are smoking, increase in age, previous cancer treatments, exposure to chemicals, and certain diabetes medicine.
There is no actual prevention for bladder cancer, but a few steps can be taken to reduce the risk, such as not smoking, eating plenty of fruits and vegetables, drinking plenty of fluids, and being safe and taking cautions around certain chemicals.
Bladder cancer is more common in white people, males, older people, and people with inflammation in the bladder. Receiving cancer treatment may improve symptoms through local control of the cancer, increase the patient's chance of cure, and prolong the patient's survival. The tumor is easily removed and is not very invasive.
Some diagnoses of bladder cancer include cystoscopy, which consists of a slender tube with a light and the lens or a small video camera at the end so the doctor can see the inner lining of the bladder, a biopsy, which is the removal of a small sample of body tissue to see if it has cancer, or an ultrasound, which consists of sound waves to create pictures of internal organs.
The invasive bladder cancer and other organs of the pelvis will cause problems with the kidney and bowel function or in the other organs of the body, such as your liver and lungs. It is mostly found early before it spreads through the bladder wall. Surgery can remove the tumors, but bladder cancer can often come back. You can lower your chances at getting bladder cancer by getting treatments like chemotherapy and immunotherapy. The tissue of the bladder is usually affected with the tumor. Okay, this has been it for this Doctor's Corner with Chris and I. Let's get back to you, Garcia.
Here we have my good friend, Chris Palmieri, who specializes in all types of cancers.
Hi, my name is Chris Palmieri, and I'm here to tell you about some of the symptoms of bladder cancer. Some of those symptoms include blood clots in the urine, which happens in about 9 out of 10 of the people who have bladder cancer, pain during urination, urinating small amounts frequently, and frequent urinary tract infections. To rewind a little bit, bladder cancer is when there's a tumor formed in the bladder. The cancer isn't all that dangerous if it's benign. It is dangerous when the cancer is malignant, and it has gone into deeper layers of the bladder. My assistant, Sarah Popper, is here to inform you about the treatments and cures of bladder cancer.
Hello, I'm Chris Palmieri's assistant. A cure for bladder cancer is removal and replacement of the bladder. This is for invaded deeper layers of the bladder wall. You have to remove your whole bladder as well as the surrounding lymph nodes. It can cause risk of infection and bleeding. In men, removal of the prostate and seminal vesicles may cause erectile dysfunction. There is also chemotherapy to kill the cancer cells that might remain after surgery.
We just got some really good news. Ty's bladder cancer is benign, and it can be removed easily. So Ty, we just got some really good news for you. Your bladder cancer came back benign, which means that you will be able to have it removed and you could have a very healthy life ahead of you.
That is such a